Hi, good evening. Austin Mayor Steve Adler. You got a minute? We're going to go over some numbers tonight. We're going to talk about vaccines, conversation that I had with Dr. Fauci and with folks in the White House this afternoon, together with a few mayors. We're going to talk about homelessness since it made it into the front page of the Statesman this morning. But let's go ahead and begin as we most often do with the numbers. So let's begin with the key indicators. Here we have the bottom left-hand corner. If you take a look, the number of new admissions is 82. 7-day moving average is 83. Boy, it's been a long time since we had a new admissions number that was below the 7-day moving average. That's a good sign. We'll take that. If you look at the color graph that's up to the right, you can see that the numbers were higher and now flattening out or coming back down all the way to that graph to the right. I have been concerned about the number of new cases we've been seeing. Remember, that number's gotten really high today. 540 new cases, 7-day moving average 601. So that's a number that is moving in the correct direction. Tuesday next week, we'll get another report from Dr. Escott as to the positivity in the community. We're at 12.8%. Let's see what it's going to be next week. It was 12.8 when he got the number. I think it ended up like at 14 when you looked at the whole week. But let's take a look and see where those numbers are. But on balance, this week we're seeing more and more of numbers that look like they may be stabilized, maybe numbers that could be maybe headed down, which is obviously what we want to be able to see. Let's take a look at the second dashboard. This shows us we have almost 65,000 cases in our city. Pretty amazing. The number of people that are hospitalized, 587. That's hospitalized tonight in our hospitals. 7-day moving average, 600. So we're below the 7-day moving average. Number of people in our ICUs, 169. That's a good number and low. And our 7-day moving average for ICUs, 176. So again, below the 7-day moving average. Number of ventilators, 107. The 7-day moving average is 104. That's our trailing indicator, right? First cases go down, hospitalizations then go down, ICUs go down. Ventilators is the second to last one. The last one to really show a drop would be in deaths. 625 people have died in total in our city. Incredible numbers across our state and across our country, over 400,000. 625 is two more than we had yesterday. That means two families are grieving. We have 26 people in the alternate care facility at the convention center. Let's take a quick look at the University of Texas dashboard. We looked at this number before. Let me see if we can pull this number in for us. So that we can see what the University of Texas modeler is showing us. You can see the R factor is 0.97. 0.97, since it's less than 1, then becomes a number that suggests that the virus transmission is going down in our city. Based on that modeling that we see, you can see the aqua green line beginning mostly flat, headed down just a little bit. Hospital admissions, hospitalizations total, number beginning to head down maybe. ICU patients. Remember, we didn't want to crest 200. 200 is this line across here. And maybe we're going to stay right underneath that 200 if we can have this trend. This number, this trend we have only works if people actually continue doing what people have been doing here in the last couple of weeks. It's harder to go out and find people that aren't wearing masks when they're around other people. It really takes a community that is taking that seriously to drive down these numbers. Best way to keep kids in school. Best way to give us a chance to open up more restaurants, open up more retail, greater occupancy levels. Best chance to get back to normal. And if we can keep that number low while we're adding more vaccines, that's the way out of this challenge. Remember that even though vaccines are going out right now, we still have to wear masks just as much, whether you have the vaccine or not, because we don't know when you have the vaccine, even if you don't get sick or you're still contagious, we just don't know. We can't take chances with the numbers. If in fact we're sending the numbers down, let's keep them going down. Let's get to stage 4. Let's get to stage 3, so that we can all do more things, including traveling again. I want to talk for just a little bit about vaccines. We have a tremendous supply issue here in Austin. We just don't have enough for everybody. We've only received vaccine for about 2% of the population, and that is just not near enough vaccine for us to even just take care of our phase 1A, our first responders and the like, or phase 1B, our medically most vulnerable. It's just not enough. I was on a Zoom call this morning with Dr. Fauci, also with some of the folks in the White House. And they're still trying to figure out what the supply of vaccine is going to be like. They're trying to figure out what the supply chains indicate. They're trying to figure out with the new executive order that the president signed to invoke the World War II Factories Industrial Production Act, what they can gear up to. We should be getting that information here in the next week or so. But we're trying to get out the vaccine as much as we can. I hear the frustration, especially those who are 1B, over 65, who are eligible for the vaccine but can't find it. We ask for your continued patience until the federal and state governments distribute more vaccine doses. We can't give away doses we don't have. Please continue to pre-register into the Austin Public Health System on the City of Austin website. That way you can get alerted when you're eligible and when appointments open up. When you get that alert that an appointment opens up, you need to get online right away in order to be able to reserve that space. I would say anybody in the city can go to that site and register. It's not going to tell you you're eligible until your turn or time comes. But go ahead and do that. If we get to the place in the future where lots of different places have the vaccine, then we'll urge people that don't have insurance to get it at their clinic or through their carrier, through their doctor. But for right now, you can certainly go on the system and register. If you do not have the internet, you can still compete and get some of these slots. If the website's not working for you, call 311. And they will help you register by phone, register for the vaccine, and sign up for an appointment. If you don't have a computer, don't have internet, website's not working for you, you can do that too. Some frequently asked questions: is the vaccine free for everybody? The answer is yes. It is free for everybody, insured, uninsured alike. And it is available regardless of immigration status, and it is safe and it is effective. And the sooner we get to 70% plus of our community having had the vaccine, the sooner we get to herd immunity. Some people said, hey, I pre-registered online, but I haven't received an email telling me about an appointment. What gives? Well, if you have pre-registered with Austin Public Health, but you haven't received an email about an appointment, it's due to one of the following 3 reasons. First, it's not your time yet. You're not eligible yet, which means you're not in phase 1A or phase 1B. Or 2, you are eligible. You're in phase 1A or phase 1B, but you're not the highest priority of people who have signed up within those groups. So there are others also in the group that have a higher priority than you. Or 3, you are eligible and you are in the highest priority group, but the appointments are filled up and we don't have any vaccine until we get more and we can open up appointments again. It's one of those 3 things. Someone asked, hey, I received my first shot from my doctor. Can I get my second shot at Austin Public Health? The answer is no. If you've already received your first round of vaccine from your healthcare provider, you got to return to that original provider for the second dose once it is available to them. They have your records. They know what you got. Go back to them. Hopefully, they're going to be getting doses out to a wider and wider group of people. Hey, do I need to take a COVID test in order to register for the vaccine? No. Even though on the Austin Public Health website, the buttons for getting a test for the virus is relatively close to the button for signing up for a vaccine, they are 2 different things. So the testing option on the website is separate from the vaccine option. If you suspect you have COVID, though, then you should still get a test before getting the vaccine because it might impact whether or not you should take the vaccine. So if you're not feeling well, go get the test. If you've been around people that have had the virus, go get the test. But understand that the test button is different than the vaccine appointment button. Some people have said, hey, I got on, I set everything up, I didn't get an appointment, I'm waiting, and now I've tried to log back on again, but I have difficulty logging back in. I type in my email address, I type in my password, it tells me they don't match up. I try to change my password, it says it'll send me an email to do that, and it never comes. What do I do when I have difficulty logging back in? And what works in this instance is when you type in your email address, john.doe@gmail.com, for example, add to the end of that .aph, Austin Public Health, .aph. So you would do first name, last name, @gmail.com, .aph. Put in your password the same way you were before. See if that works for you. If it doesn't work, call 311, but we're finding that works for the overwhelming number of people. Let me conclude tonight by talking a little bit about homelessness. You may have seen some conversations about it in the news this week and in the Statesman about homelessness and camping in Austin. And obviously, there's been a petition turned in to reinstate the camping ban in Austin. I will tell you that returning to the olden days when we had a camping ban is the worst choice that we could make. When we banned camping, not only did we correct a civil rights issue, but we really saved a lot of people. A lot of people living in the woods and the streams and by the railroad tracks are now in public, and we're saving a lot of them, getting them health care and services that we couldn't find before. Sending people back to those dark, cold places is not the right answer. But I will also tell you that what we're doing now also is not working the way that it needs to. You know, I hear and I see the concerns that are playing out now. I also walk and drive by the tents every day, and we don't want any of our neighbors living in tents under freeways. We want people in homes. You know, there are public spaces that many of us used to use that are now places where people are in tents, and these spaces are not and don't feel like they are shared spaces anymore. We know that policing and criminalizing homelessness will never end homelessness. Only homes can end homelessness. Chasing people around the city, making them move, and there's no good place for them to go, chasing them back to places where we just can't see them. Hiding homelessness will never end homelessness. It'll just hide it. And it'll continue to grow at exponential levels until the problem becomes so big it's bursting at the seams, and then it'll be at a scale we can't fix. The challenge we have in Austin is of a scale we can fix, and we need to. But we have got to start doing what we're doing differently. We've got to do a better job of housing people. We need 2 things. We need an implementation plan, an implementation schedule that tells us all how long it's going to take to be successful with the challenge of homelessness, and what to expect along the way. What do we need to see every 3 months, every 6 months, in order to make sure we're on track to reach our challenge by the goal and the date that we set. And then in the more short term, we have to do a better job of managing shared public spaces. That's why this city is focused on bringing in hundreds and hundreds of homes. And we're going to bring them online this year, all kinds of homes. We focused pretty much on permanent supportive housing, which is really important. And at the end of the day, what we need most, because that's where people can take the best advantage of services, and that's where they get off the street and they don't come back. But we also have to have many more housing that is emergency housing and rapid rehousing. And we have not spent the attention to that classification of housing. We haven't gotten the level of housing we need at any one of the levels. We need to do that. We need to get it for each of the levels. At our first city council meeting of the year, which is next week, we're going to authorize moving forward, I think, on purchasing 148 units for permanent supportive housing. And our goal used to be just 100 a year. And we know that goal is woefully insufficient if we're actually going to meet the challenge of homelessness. But we also have to get some of these more rapid rehousing, the mini homes, and put them in areas where folks can be safer and better than where they are right now under highways and in some of the other areas in our city near highly trafficked roads. We need to do differently what we're doing. We need to show faster and more visible progress. I believe that if we do this together as a community, we can end homelessness. And wouldn't you rather end it than just hide it? Can't go back. It would be inhumane and cruel. But we can't keep doing what we're doing either. We've got to do better. And that's what this year is going to be all about. With that, it's Friday, weekend starting. You all have a good weekend. Please be safe, take care, and good night.